to betadine or chlorhexidine. My patient says no. Okay, so I'm going to inspect the genitalia to make sure that there's no lesions, sores, cuts, open areas, anything like that. We're going to use these as cleansing cloths here. So on the female patient, what we're going to do is we want to clean on the inside of the labia, okay? And if you're going to use it like a washcloth, then you can fold it and move it down. So we want to do down both sides. We want to clean inside, not out here, okay? So we want to clean inside, and down. Now, if your patient, if they've had poor hygiene down there, then you may want to do more cleaning, okay? If you have a male, you want to clean around the head of the penis, okay? So I've cleaned that area. I'm going to take off my gloves. You can have a trash can close by. Then I'm going to hand hygiene. If you remove dirty gloves and do not hand hygiene, that's an automatic failure, okay? So we have soap and water and here. I'm going to sit this back over here so that I have room on my table here, okay? I'm left-handed, so I'm going to stand on the left side of my patient. If you're right-handed, stand on the right side. I'm going to open my Foley kit and make sure that the openings are on top. I'm going to take this and I'm going to use this as my trash bag. Okay, Miss Rogers, do you mind if I sit this here beside you? Okay. All right. So I want to open it away from me first, then the sides, and then closest to me, okay? And I'm going to leave that there until I get on my sterile gloves, because everything in here is sterile. And of course, you want to provide privacy for your patient, okay? All right. Do not let this touch that. If this happens, you have contaminated, okay? Because once I take this out of the package and lay it on here, I've contaminated the underside of it. So that is a contamination, okay? So I'm going to pick up my gloves, whichever hand you're most comfortable in. I do my dominant hand first, down. That was close. I'm out. All right. Okay. So now this is what I'm concerned with. If I need to move this closer, put your foot down there and move it. All right. I'm going to take out the two trays so that I have a better working area. I'm probably going to contaminate time out here. Okay. You're going to have two drapes in here. All right. Take the first one and just kind of come down and just kind of drop it. Okay. It increases your sterile field. Then the fracinated one, and I cut this one. All right. Just take this and drop it there. You can touch here and there. Now that hole's a little exaggerated because I made it, okay? So now all of this is my sterile field here, okay? Now I'm gonna prep my catheter, all right? Pull down the plastic shield on here and open it. In here you will have, open up your lube. Take your catheter, put it in there. If it's a female, do 1 inch to 2 inches. If it's a male, go 3 to 4 inches, okay? I'm gonna sit this back in here, and then I'm gonna take my saline from my bulb syringe and put it here, okay? Then I'm gonna open up my swabs, and I'm gonna lay them on here. or in the package so that I can get it easier, okay? So now I'm ready to start, but what I'm gonna do is I'm gonna pick this up. This isn't working. And I'm gonna sit this here, okay? So now I'm gonna contaminate my right hand. I'm doing this left-handed, okay? Okay, Miss Davis, I'm gonna start now. You're gonna feel me clean you down here. All right, so I'm gonna take one swab and I'm gonna wipe down and I'm gonna come over here, okay? I do not want to go over this or I have contaminated that, okay? I'm gonna take my second swab and go down the other side, come over here. Take my third swab and I'm gonna go down the middle and in here, okay? Now I'm gonna pick up my catheter. I'm gonna ask my patient to take a deep breath and bear down while I insert it. Okay, now can you take a deep breath and you're gonna feel a little bit of pressure here. Wait a minute, I can't see it. Here we go. Okay. Okay. All right, you can relax now. If I see a little bit of urine coming out, I'm gonna go in a little bit more. I'm gonna hold my catheter while I insert the bulb. Okay, and if you're not in far enough, the bulb will not inflate. Okay, and then I'm gonna take that off and then hang my bed on, or hang my bag on the side of the bed, okay? What you wanna do is maintain that this is always in sight, okay? If you need to move it closer to you, use your foot, okay? Was that helpful?